Hi, this is Dr. Tom Rogers at Performance Medicine. If you're looking at this on the video, you're seeing that I'm getting an IV started, an IV cocktail, which, if I'm feeling a little under the weather or just not feeling right, if I've had jet lag or if I'm just what under the weather. A couple times I've gotten it when I just didn't sleep well the night before, or I'd gotten a heavy therapeutic massage, or just drained for some reason. For one of the other reasons that you feel bad. So a lot of times, I just want to show you how easy this is to get it, because it's really painless. You don't feel a thing, in our offices. All our offices do this, and it's just a wonderful treatment to kind of rejuvenate you. I also take a B12 shot every week, and just keeps my energy going. But Katie is starting this IV, and she's really good at it, obviously, and didn't feel a thing. And what I'm going to run today on here, if you'll glance up at that, it's a Myers cocktail. I can get this thing in half hour, maybe sooner. I've got
Sometimes 45 minutes just depends.
but it gives me a good chance to just relax. And sometimes another cool thing I'll do, I don't know where our oxygen machine is, but sometimes for athletes, especially bikers, that I give these things for, like after races where they're dehydrated, I will give them oxygen by nasal cannula or mask. Sometimes they get a little hypoxic if they've really exerted themselves, and hey, why don't we wheel that oxygen concentrator in here? Is it down here?
It's right behind
Is it right behind me? I want you to look at this thing too. As a matter of fact, I may take some oxygen myself right now. Oxygen is a wonderful thing. If you're really tired too, another thing that can really help you is just breathing pure oxygen. I prefer the nasal cannula. We have a mask too, but there's no tanks involved. This machine, which was actually given to me by a very dear friend of mine, an ER doc. I won't mention his name, but a wonderful, outstanding ER doc. Actually gave me this machine, and it's unlike having tanks. You plug this right into the wall, and you can use this 24 hours if you need it. I've actually sent this oxygen concentrator to one of the patients that we were treating for COVID, and his O2 sats got low, and he did not want to go to the hospital. At the time, I couldn't get anybody to go in and give him oxygen in the house. Like now, we have some companies that do that, and they arrange everything. But so I sent this one out to him, and he existed on this thing for how long? Month?
Golly.
I mean,
45 days almost.
a long time, daily use. So this is a great little adjunct. And also, what I use the oxygen for is to break up a migraine headache, especially a cluster headache. The nasal cannula. Which cluster headaches are another variety of a vascular headache that are awful. I mean, they get them in clusters of several in say like a 7-day period. They're more common in men, and usually migraines are more common in women. But so if they get it at the onset and can't break it, then they'll come in here and we'll hook them up to this oxygen, and gosh, at least half the time it completely aborts their migraine headache, especially if it's a cluster headache. So you're getting two cool things here that can help patients out. We like to think a little bit outside the box. Your typical family doc's not going to have this stuff in their office, and most of them don't know what an IV cocktail is. we have several ingredients. Let me put this on.
How high do you want it?
Put me at about 6 liters, please. Makes a little bit of noise, but not much. But I'm breathing in pure oxygen through my nose, and it's amazing how this is going to rejuvenate me a lot. For some reason, I slept terrible last night, and I think it was because I ate too late. I kind of was forced to eat a little bit later. I ate a spicy dinner, and I had a little bit of reflux in the middle of the night. That's why I'm trying to keep the head of my bed up. But anyway, I had a fitful night of sleep, and today I decided just to try the IV and see how it'd make me feel. The last time I had one of these a couple months ago, I came in here dragging, and after that, I felt like $1 million. I'm not lying; it really, really works. We do quite a bit of these. The Myers cocktail, basically, it's not a real high dose vitamin C. The 3 cocktails we do most of are the Myers, which is just kind of a rejuvenation IV, and then we do just normal saline for rehydration. A lot of athletes will come in here and get it, especially if they've cramped and they need some salt water in their veins. And then we have a higher dose vitamin C that we use for various reasons: chronic fatigue, Epstein-Barr, fibromyalgia, sometimes even people that have undergone cancer. It really rejuvenates them, and we can't claim that it cures cancer, but it sure does seem a very effective adjunct for cancer patients. Usually not while they're getting chemo, but before or after. We've even had a few oncologists. One I know for sure has sent us a few. It's not going to hurt you. And sometimes we give very high doses of vitamin C for that. And if you do it in the correct form, it doesn't cause the GI problems that otherwise it could. I don't think we've ever had a person have diarrhea with high dose vitamin C in here. But when you take an oral vitamin C, for example, you only absorb about 20% of that actually gets into your cells. When you do an IV vitamin C, 100% of it goes into your cells. And we're talking about, we'll start out with 25,000 milligrams directly into your vein. Whereas when you take an oral vitamin C, you're taking 1,000 milligrams once or twice a day. So it's a much more effective treatment. It actually turns into hydrogen peroxide, which has a lot of benefits for it. So the Myers cocktail also, besides vitamin C, it doesn't have the huge doses of C in it. It usually has about 8 to 10, I think, it has magnesium and has the B vitamins in it, and zinc. It's actually fairly relaxing too, probably because of the magnesium in it. But it not only energizes you, but kind of relaxes you at the same time. So and there's a whole host of vitamin cocktails we can come up with, and you need to mix them fresh. You need to know what you're doing, which we do. We've been giving these things for years. I think I'm getting a good high as oxygen too. Just trying to breathe. I'm becoming a nose breather. I used to be more of a mouth breather, which causes all kinds of problems. You've seen my podcast on mouth breathing, especially at night, and how harmful it is to you, and how it in kids, when they do it all the time, they come up with a misshapen face and a lot of dental problems as well. I had a nice chat with Dr. Jewett about this, local orthodontist, one day, about kids and being mouth breathers, thumb suckers, that kind of thing. But certainly, life's about energy, and you want to be energized, and in today's hectic lifestyle with the fast-paced multitasking, I know for one person, I'm a workaholic. I work a lot, and when I'm not in the office seeing patients, I'm researching, writing, podcasting, and I'm kind of constantly bombarded by patients and friends, doing favors for them, I guess, and helping them out. But there's a lot of stress with that. A lot, you need to learn how to relax. I think one of the best things I do for relaxation is just riding my bike and working out. I also love my infrared sauna. I'm off today, so one of the first things I'll do when I get out of here is go jump in my infrared sauna and start sweating. A great way to detox. So as we get older, we need things to kind of help us out like this. Something will kind of rejuvenate you. You've got to eat right. You've got to get a good night's sleep, keep stress down. You have to move every day. You have to balance your hormones. You've got to detoxify. That's why I love my infrared sauna. But anyway, so if you are run down, have chronic illnesses, you might want to ask us about our IV therapy. I'm getting the Myers cocktail today, and I'm on my. I guess we've done over half of this since we've been sitting here talking, so I already have half the thing in, and I can tell that this oxygen is really kind of clearing my head a lot too. Come see us at Performance Medicine. Get your IV cocktail, especially with chronic illnesses. Or just if you're just run down, just call us and we'll get you in that day at all our Performance Medicine offices. I hope I'll finish up the treatment here. I know you're getting bored. I'm running out of things to say. So you guys have a good day, and I'll talk to you next time.